Hello, my name is Ibrahim Adam. I am a practical nurse learner at Bobali College, and today I'm going to do my lab assessment for Nursing Foundation 3. This is my ID, front side, and this is the back side. Okay, so I'm gonna start to hand sanitize, and just this is the area where I'm just going to work on it. It is very tight place. This is the place that I'm going to work on it. So first I'm gonna just read the scenario. Alison Chinook is a patient who has been admitted with urothelial carcinoma requiring chemotherapy and pain management. The time is 9 in the morning and Alison is due to receive an antiemetic prior to her first scheduled chemotherapy, and learner's signature. I have to sign it. Okay, so the next step is I have to just grab my MAR and look my order. It is for Chinook Alison. Date of birth ID number is 6149 73042. Date of birth 1960 December 11, and today's date is June 20, 2020. Time is 9 in the morning. And the medication order is dexamethasone 8 milligram IV piggyback one time prior to chemotherapy. So I have just seen the order. So I have to look the doctor's. I have to compare the doctor's order with the MAR. Okay. This is my doctor's order. This is my MAR. So from doctor's order, I have Chinook Alison. From my Chinook Alison, ID 6149 73042, 6149 73042, matching date of birth 1960 December 11. My date of birth 1960 December 11, matching. Today's date is June 20, 2020. Time is 9 in the morning. From doctor's order, Chinook Alison, gender is female, and admitting diagnosis, this is urothelial carcinoma. Visit reason is chemotherapy or symptom management. Allergic, no known allergic. And medication from doctor's order, dexamethasone 8 milligram IV piggyback prior to first dose of chemotherapy, and the status is active. From the MAR, I have a dexamethasone 8 milligram IV piggyback one time prior to chemotherapy, which is matching. Okay, so I have to put away my doctor's order. Then I have to grab my MAR and collect further information on my drug or medication. So this is my drug monograph. Okay, so I have to write down some. So this is the paper for the scenario paper. This is the rating that I have just write down before. So I'm going to write the same information. So on here I have a dexamethasone. It is the class is adrenaline, and for intermittent IV infusion route. Indication for prevention of chemotherapy-induced nausea and vomiting, the one which we are going to use. And doses for adults, this is for antiemetic 8 to 20 milligram before chemo. And so the order dose is 8 milligram IV piggyback. And admission, IV infusion, I have to infuse it I have to infuse it in 50 to 100 ml over 20 to 30 minutes. Okay, so for reconstruction, available medication availability is 4 milligram per ml, and so the doctor's order is 8 milligram. The availability is 4 milligram per ml. I have to calculate the ml required to administer. So 4 milligram per ml is equals to 8 milligram per x crisscross, and I need 2 ml of dexamethasone. So that is the amount I'm going to administer. And so I have to dilute it in normal saline. The solution that I'm going to use is normal saline. The amount is 50 to 100 ml. Sorry, 50 to 100 ml of mini bag over 20 to 30 minutes. So I've done that one. Next one is what are the potential hazardous or side effects. So it have hypertension or congestive heart failure, hypertension, and CFH and any weakness on musculoskeletal and impaired wound healing, petechiae, rashes, and any nausea, depression. What the contraindication for? Contraindication for hypersensitivity and systemic fungal infection. Nursing implication, I have to monitor the baseline for potassium and blood glucose and fluid balance, input and output, and weight daily. So I have to do this, I have to monitor this. So I've just done this one. And the next step is I have to just collect my stuff. Okay, so the stuff that my supplies are, this is my medication, this is my alcohol swab, this is my mini bag solution, this is my secondary IV line, and this is my syringe, needles, and this is going to be my labeling for medication and IV, secondary IV tube, and this is my sharp containers, and most of my supplies are already used one, so beware of that. And the next step is I have to do my hand sanitize and do my 3 checkings on mini bag solution, comparing with the with the monograph. So in my hand I have it 0.9% sodium chloride, 15 ml, and expiry date is January 21st. On the monograph I have to dilute it in normal saline, and the amount should be 50 to 100 ml mini bag over 20 to 30 minutes. And the reason for using is intermittent infusion. So this is mini bag solution I'm going to use for medication dilution. First check is done. Second check, I have in my hand 0.9% sodium chloride, 15 ml, expiry date is January 21st, and this is mini bag solution, and I'm going to use for medication dilution. On the monograph I have to dilute in normal saline, and the amount is gonna be 50 to 100 ml mini bag over 20 to 30 minutes, and the reason is I have to use for intermittent infusion of medication. Okay, I have done my second check. My third check, this is 0.9% sodium chloride, it is 50 ml, and expiry date is January 21st, and this is the mini bag solution, and I'm going to use it for medication dilution. From the monograph I have to dilute it in normal saline, and the amount is 50 to 100 ml mini bag infused over 20 to 30 minutes, and the reason is I have to use for intermittent IV infusion. So I have done my 3 checks. Okay, so the next step is I have to double check my calculation. So the calculation is, it is 8 milligram IV piggyback, 8 milligram, the availability is 4 milligram, so I do need 2 ml, which is correct. So I've done my okay, so the next step is I have to do my first check on medication. Okay, so first check is Chinook Allison, ID 614973-042, date of birth 1960 December 11. There is no name on this one because this is stock medication, but I have it dexamethasone. It is 4 milligram per ml, and it is 10 ml vials, and the expiry date is 2028, which is good to use. And today's date is June 2020, time is 9 in the morning. From monograph, from the MAR, I have dexamethasone 8 milligram IV piggyback, 1 time prior to chemotherapy. I'm going to use this medication for anti-emesis. Okay, I have done first check. So the next one is I have to just withdraw my medication. To do that, I'm gonna just clean it. For 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, put in a garbage. And then air dry. Open my. This is my syringe. It is 3 ml syringe. It is expiry date is 2024, and it is supposed to be intact, but I have used it before. And this is my syringe. This is blunt fill syringe. Its expiry date is 2024. It is supposed to be intact, but it is open. I have used it. Okay, so I am gonna open it. This is 3 ml because my medication is 2 ml. That's why I select 3 ml. So this is vials. I'm going to inject 2 ml of airs. Okay. Remove the bubbles. No bubbles. Just a splash a little bit to get the exact amount. There is no any air. Okay. Okay, this is 2 ml medication, and I have to just recap it. And do my second check with the mark. Okay, this is Chinook Allison, ID 614973-042, date of birth 1960, December 11. And over here there is no names because this is stock medication, but in my hand I have it, dexamethasone 4 milligram per ml. Expiry date is 2028, which is good to use. This is 10 ml vials. And in my syringe I have 2 ml, which is equal to the 8 ml 8 milligram. So this is today's date is June 20, 2020, and time is 9 in the morning. From dexamethasone 8 milligram IV piggyback 1 time parallel to chemotherapy. And the reason why I'm just using this one is for anti-mesis. So I've done my second check. So then I have to just inject into my mini bag. So I have to clean my mini bag. Thirty seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, put in a garbage. Then inject it. Directly goes into sharp containers, and then mix it the medication, and then write down the labeling. So the labeling ID from the labeling medication name, it is dexamethasone. dexamethasone 4 milligram per ml, and expiry for it is 8 milligram, 8 milligram per ml, IV, piggyback, and there is June 20, 2020. Time is 9 in the morning. Frequency, it is start, and patient names from here, from the monograph: Shunuk, Alison, and my name, my designation, Ibrahim Adam, initial, and PNL. ID is 61 49 73 042. Okay, so I've write down this is dexamethasone 8 milligram IV piggyback and dates. Okay, then I have to stick it to the cleanest side. So this is the cleanest side. Okay. Okay, so I'm done over here, so I'm gonna go to my patient. So I'm gonna go to my patient. I have to have my MAR, my informations, my medication, secondary IV tube, labeling for my secondary IV line, and my monograph, my compatibility, and my alcohol swab. So I'm gonna go to my patient room. Knock knock. Hello, my name is Ibrahim Adam. I am a practical nurse learner at Bow Valley College, and today I am here to hang your medication. So can you please spell your first and the last name? I have to do hand sanitize. Can you please spell first and last name? He said Shunuk Alison, date of birth 1960 December 11. So I have to just compare his ID with the band with the MAR. Okay, Shunuk Alison, date of birth 1960 December 11, date of birth 1960 December 11. So the right patient. So the next one is I have to just safety check the bed break. I have to give privacy and move the bed to the working head, then assess my patient. So I'm gonna start assessing from the injection side. So I have to assess the injection side for any pain. Do you feel any pain or tenderness? No. Is there any fluid or blood coming through? There is no any blood or coming through the IV line. If there is no any rashes or there is no any rash, there is no redness, ecchymosis, and so it is good. So the next step is I have to just assess the primary line, primary back. So comparing with my monograph. So the primary line, it is normal saline and IV continuous 10 ml per hour. So this is the normal saline, and it was changed this morning, and it is continuous. I have to just open it because I just closed it because it is gonna run out of my water. So I'm gonna just open now. Okay, it is running. Okay, so and it is running now. So I have to check for the compatibility. So dexamethasone, it is compatible with 0.9 sodium chloride. So this is 0.9 sodium chloride. So it is compatible. So I have to check for any kinks or air in the tube. There is no any kinks or airs in the tube. Okay, it's good. And the next step is I have assessed all, so I have to do my third check. So I'm gonna do my third check with the monograph MAR and this is my MAR and this is my mini bag solution. Okay, I have it. Chinocalicin, ID number 614773 date of birth 1960 December 11, and ID over here 614973 which is matching, and patient name Chinocalicin which is matching, and medication dexamethasone 8 milligram IV picky bag. Dexamethasone 8 milligram IV picky bag 1 time prior to chemotherapy, and today's date is June 2020. Time is 9 in the morning, and frequency is start. And the reason why I'm just using this medication is for antiemetics, and this is my designation. I have done my search check. So the next step is I have to just open my secondary line. Open it and then hold the tip. Put this one away. Hold the tip. It is usually open, so I have to close it and then connect it to my primary tube. Clean it. This is a white tube. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30. Okay, put in a garbage and then connect it. And then prime it with the prime it. So it is primed. Okay, it is primed now. Then I have to strike it to my mini bag medication. Remove this one right there. Open it. Strike it very hard. And okay. And then it's not flowing because I've closed it. Then I have to pull this one down and put this one up, and then hang this one with this secondary line. Okay. Now I have to set the rates. So the rate is gonna be like I have said, it is 15 ml. It's going to be run over 30 minutes. So if there is a pump, it's going to be like 100 ml per 1 hour. So 15 ml, because there is no pumping machine, the rate is going to be like 15 ml per 30 minutes, which is going to be like 17 drops per minute. So that is the rate. I'm going to adjust it. I have to open the primary one. Okay, so it starts dropping. So I have to write down the secondary IV line. So it's gonna be date is June 20, 2020, and time is 09 in the morning. The line is secondary. Solution is 0.9% sodium normal saline, and the initial Ibrahim Adam. Okay, So I have to just connect it to my secondary IV line. Okay. Okay, so I have to connect it. Then I have to do my teachings. So my three teachings is gonna be, okay, let me know if there is any pain, if you feel any pain or tenderness. Let me know if there is any fluid or blood is coming through the IV line, and let me know if you are just having any rashes or fevers. And I have to just, if there is any rashes or fevers, and I will just check in on you in 5 minutes, and I have to sign my MAR. Is signing my MAR Ibrahim Adam in my initial and my designation PNL. This is my MAR. I have signed it, and I have to give the call bell for my patient. Please, here is your call bell. Call me if you need any help, and put the bed to the lowest level, and then give the privacy, undo the curtain, and then hand sanitize and collect the garbage, all the garbage, put in the garbage bin, and then I'm done. So thank you very much.